Heart disease is the leading cause of death in America, and fighting that is something the entire Palos Health Cardiovascular Institute takes very seriously. We have built a comprehensive team of doctors, nurses, technicians, dietitians, and technology that are second to none.
Traditionally, physicians have practiced as sort of the top of a pyramid in which everybody follows their orders and manages the care of the patient. We're creating a different model here, and that's where the physician is part of a team. He may be the leader of the team who directs things, but the advanced practice nurses, the technicians, are all as equally important in the management of the patient.
Our award-winning Cardiovascular Institute offers responsiveness, a collaborative team of experienced doctors, nurses, and technicians working efficiently together, modern facilities with state-of-the-art technology. It's all right here, close to home, start to finish.
A good example of the responsiveness of Palos Hospital personnel is our care of acute myocardial infarction patients. Patients who present to the hospital with a heart attack are taken to the cath lab and have their artery opened up within 90 minutes. That's state-of-the-art across the country, and we've basically been able to manage that and in fact drive that time limit down. Timeliness also plays a role in how nurses respond to patients and how they educate the patients, how efficiently we manage the patient in the hospital so that they can go home to their loved ones. Palos is excellent at that level of care, and we will continue to do that.
There are many success stories that we're proud of, and Dr. Terrence Wall is certainly one of them.
July 6th of 2017, I was opening up my brother's house in Palos Park. He was having some air conditioning work done. I happened to know the company that did the air conditioning, got his workers inside the house and got them going, and then we were leaving. Prior to that, I had no symptoms. I had no shortness of breath, chest pain, really nothing that would make me think that there's something wrong. And as we were walking out, the owner and myself, to our cars, I said to him, "Skip, I'm going down." And then I collapsed. So he immediately started pushing on my chest, and miraculously, this police officer comes by, and she did CPR on me for like 8 minutes before the paramedics got there. They got to the emergency room and called Dr. Rowan, who was luckily in the hospital that day. And he rushed me to the cath lab, worked apparently pretty hard on me for quite some time, and couldn't get through, so I was going to have cardiac surgery. My wife was in the room with my oldest son. They're all crying. So I went down on a Thursday, had bypass on the following Tuesday, and I went home, I think it was on Sunday. I've seen Palos Hospital grow from really a community hospital to a top-notch, great hospital that it is today. Second, really, I don't think to anybody else.
For the past 6 years in a row, Palos Health has been the recipient of Healthgrades America's 50 Best Hospitals for Cardiac Surgery, and for 9 years in a row, the recipient of Healthgrades America's 100 Best Hospital of Cardiac Care. Here are just a few of the reasons why others take notice. We have an electrophysiology lab, cardiac catheterization labs, and surgical suites solely dedicated to heart patients, award-winning nursing staff, and we use advanced technology such as the Watchman and transcatheter aortic valve replacement.
The use of TAVR, or transcutaneous aortic valve replacement, is something that we now do at Palos. Up until very recently, that was only done at university centers and tertiary centers. It's another example of how Palos keeps up with the times, the technology, and the use of that technology to take care of our patients.
At the Cardiovascular Institute at Palos Health, we're all heart. We have the experience and expertise to provide high-quality heart care right here in your community. Our care really starts with prevention. From there, a diagnosis, all the way to treatment, rehabilitation, and recovery. We work together to provide compassionate, personalized care. At Palos Health, we're focused on you.